A developing story that we have been on all day long, the UC Davis Medical Center treating a patient who may have contracted Ebola. This possible Ebola case started at a different Sacramento hospital, and its ER has been closed all day.
We have team coverage tonight. Let's start with KCRA 3's David Bieniek, live at the UC Davis Medical Center, which released a statement about this case just about an hour ago. David?
Edie, good afternoon. Late today, staff here at the UC Davis Medical Center did indeed report that the suspected Ebola patient is in good condition. We don't yet know if this is a man or a woman, nor the patient's age. We should know late tonight or tomorrow if this case is likely to be real. Workers wore protective clothing, including mask and gloves, as an ambulance brought the suspected Ebola patient from Mercy General Hospital to a non-public entrance at the emergency department of UC Davis Medical Center.
We were in the ER, and then they announced that they were bringing the person in that had
This woman, who didn't want her face shown on TV, says she was in an ER exam room with her granddaughter at the time.
In the waiting room, people got up. There was some that got up and left.
As soon as they heard Ebola?
Yeah, they just got up and left, walked right out of the hospital.
Health officials said this patient is at a low risk for Ebola, but does meet the government guidelines for being tested. Those guidelines include Ebola-like symptoms such as diarrhea, stomach pain, and cough, plus recent travel to countries in West Africa. UC Davis doctors and nurses have been receiving Ebola equipment and training for months. In December, the federal government designated this hospital as one of 56 priority Ebola treatment centers nationwide. Some nurses who had been concerned about a lack of preparedness say the situation has improved.
We know that the nurses have been drilling since then on a day-to-day basis, and we know that they are so much better prepared.
However, at least one non-medical staff member at the hospital, a house cleaner, told us she didn't want to go anywhere near the suspected Ebola patient's room.
I'm not trained, so I said if I was asked to clean that, I won't clean either because I'm not trained.
UC Davis has declined to answer any questions on camera today about this suspected Ebola case. The hospital did call a news conference earlier this afternoon, but canceled that news conference at the last moment, saying it needed to gather more information. Live in Sacramento, David Bieniek, KCRA 3 News.
All right, David, thanks for that part of our coverage. And UC Davis Medical Center is one of 5 hospitals in the state that is designated to deal with Ebola cases.
KCRA 3's Rob Malcolm is here now with what we know about the procedures that a hospital is trained to use when they have somebody walk in like this.
Yeah, that's right, Gulston, Edie. It's amazing what they have to go through. Well, back in November, UC Davis gave us an inside look at some of the protocols for dealing with Ebola. Now, the hospital started training their staff in September during the height of the Ebola scare, including practicing putting on and taking off all that protective clothing. And it's not an easy task. Just removing all that clothes and equipment requires 30 steps. They told us those steps are required because of the unique dangers associated with Ebola, including how easily it can spread through bodily fluids left on clothing. Now, as an extra precaution, hospital staff will be working in teams of 3. One person helps the other caregiver who comes into direct contact with the Ebola patient, taking off their protective clothing. Now, the third also acts as a supervisor and works with a checklist to make sure everyone is following the proper procedures. So it is involved, and of course they have to err on the side of caution with this.
Absolutely. It's a tedious process, but it's understandable why they go through all that. Thanks, Rob.
Right.
Well, the patient initially showed up this morning at Mercy General in East Sacramento, where they immediately started decontaminating the emergency room. It's still closed at this hour.
KCRA 3's Sharikina Shams is live for us at Mercy General with why the hospital says it did exactly what it was supposed to do today. Sharikina?
The main entrance to the emergency room at Mercy General is here on 39th Street at the very back end of this parking lot behind those construction trailers. So the parking lots here have been open all day, but here's what it has looked like most of the day outside the ER. With its doors closed and surrounded by yellow tape, Mercy General said today that the emergency room is being cleaned. The hospital didn't give any details about what that cleaning entails or allow us to see the process. A spokesperson would only say that the cleaning is part of the protocol they use when patients who may have infectious diseases are treated here. Yet, they couldn't tell us the last time a cleaning like this was done for treatment of more common infectious diseases. Still, people visiting patients here were glad to hear of the cleaning.
I think they're one step ahead.
To be cleaning the ER?
Yes.
You think that's a good idea?
Yes, and have it all locked down.
I think they're on track. They're not taking it lightly, and I don't find it as a threat. We have an elderly relative in the hospital. She's up on the 4th floor. I don't think it's going to impact her care.
Now, a spokesperson for Mercy General also did tell KCRA3 that the hospital staff here are not under quarantine. The hospital would say little else, though, about the circumstances that brought that patient here or the circumstances that staff were faced with when they decided to transfer that patient over to UCD. Live here in East Sacramento, I'm Shara Shams, KCRA3 News.
Shara, thanks. And